Can pattern hair loss be cured?
Genetic pattern hair loss, or androgenetic alopecia, affects a large percentage of both men and women. While advancements have been made in the management of hair loss, such as the use of DHT blockers for male pattern hair loss, and our own treatment innovation called TrichoStem Hair Regeneration, an actual cure for genetic pattern hair loss remains elusive. So many predictions of a cure by a certain year with potential breakthroughs in hair cloning are still far from actual clinical application. There is still hope. I'll discuss why genetic pattern hair loss can be effectively managed to optimize your scalp coverage while we all wait for a baldness cure. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. Throughout much of my career, I focused on helping people with hair loss by performing hair transplant surgery. My objective was to improve your appearance from the perspective that your hair frames your face. This meant transplanting hair from a very limited donor area in the back of the scalp and moving the hair to the front. The challenge and frustration that we faced was that successfully performed surgery did not guarantee a successful outcome. For example, a significant percentage of hair grafts, in spite of being transplanted properly, would fail to grow. Another issue was that the area where the hair grafts were harvested from would sometimes not heal as well as we'd expect. Around 2011, I tried to improve the results of hair transplant surgery by using a wound healing material called extracellular matrix produced by the company ACell. We observed that a year after surgery, not only did the transplanted hair growth yield improve, but I noticed that areas of native hair that wasn't transplanted had more hair growth and that the hairs had grown in significantly thicker. Inspired by this remarkable outcome, I decided to pursue the development of a standalone, non-surgical treatment for hair loss. This meant developing optimal formulations, delivery methods, and to calculate the timing of dose delivery in order to get the best results with the fewest number of treatments for the longest duration of time. Over the course of several years of development, I eventually came up with my own hair loss classification system and a system of customized formulations with treatment plans for each of the categories of patient profiles I created. We have seen improvement in scalp coverage in more than 99% of our male and female pattern hair loss patients without the need for surgery. I named this system TrichoStem Hair Regeneration, and we built a freestanding facility specifically for this treatment in Vienna, Virginia. The concept of curing hair loss assumes that even the baldest individual can regain all of their hair back and have a full head of hair. The same cure concept should also mean that hair loss can be stopped completely. In actual practice, a medication used for men like finasteride doesn't stop hair loss, but can significantly slow down the thinning process. By using our TrichoStem Hair Regeneration system, we're able to thicken your thinning hair and stimulate the regrowth of dormant hair follicles. Our treatment is predicated on the presence of hair follicles. So for example, a bald man with a long-standing smooth scalp does not have viable hair follicles, which could be reactivated. This means that a cure for hair loss would have to create new hair follicles to restore the scalp coverage of a man who's bald. Another reason why genetic pattern hair loss can't be cured is that progressive hair loss is hardwired in the DNA. This opens up a whole other concept of genetic engineering, which is currently not an option. A lot of people are under the impression that hair transplantation is the ultimate treatment for hair loss. Unfortunately, a hair transplant can only transfer or transplant a limited number of hairs from the back of the head to a much larger surface area on top of the scalp. Genetic pattern hair loss is progressive, and hair transplants by themselves don't treat progressive hair loss. The native hairs located near transplanted hair grafts continue to thin after hair transplant surgery has been performed. This is a major issue since the number of hairs genetically resistant to hair thinning used for transplantation exist in a very small area in the back of the scalp. This means that as hair loss progresses, the number of transplantable hairs to make up for the loss from the progression is simply insufficient. Generally speaking, men who start losing hair in their 20s and undergo hair transplantation will often find themselves in their mid to late 30s with limited scalp coverage consisting only of transplanted hairs. A few years ago, the hair transplant industry moved away from FUT or strip surgery to FUE or follicular unit extraction surgery. Regardless of technique, the donor area limitations remain unchanged. FUE surgery can be also seen as highly counterproductive since FUE surgery requires the harvesting of grafts from outside of the permanent zone. That means that these transplanted hairs are just as prone to hair thinning as the hairs they're replacing. In addition, FUE transplants also have a higher rate of damaged and non-viable grafts in comparison to FUT surgery. This is due to the technique in which grafts are harvested for FUE surgery. FUE grafts are harvested with an extremely narrow and cylindrical blade. This causes a significant percentage of grafts, typically about 30% of them, are transected. That means that the hair is harvested without harvesting the root. Transplanted hair without a root cannot grow. A common criticism of hair transplant surgery is the pluggy look or the fake look of a person who obviously had hair transplant surgery. This is due in part to the difference in hair density between your native hair and your transplanted hair. You see, your natural hair density is in the range of 50 to 75 hairs per square centimeter. However, transplanted hair grafts cannot exceed 20 grafts per square centimeter. This is because your skin's ability to heal and support the hair grafts is limited by the structural integrity and blood supply of your skin. As I discussed earlier, the management of hair loss in men can include the use of the drug finasteride. The introduction of finasteride in the 90s as a drug which blocks the formation of dihydrotestosterone, or DHT, was a major step in the management of male pattern hair loss. The hormone testosterone is converted into dihydrotestosterone, or DHT, by the enzyme 5-alpha reductase. Hair that is sensitive to DHT will miniaturize and die. A DHT blocker like finasteride or dutasteride block the enzyme 5-alpha reductase and reduce your DHT level. Finasteride does not affect testosterone levels. Female pattern hair loss affects about 30% of women under 50 and about 50% of women over 50. The decrease in estrogen, which occurs with menopause, is generally accepted as one of the factors contributing to the hair loss progression, particularly in women over 50. In contrast to male pattern hair loss, there is little evidence supporting the use of any oral drug like finasteride for the treatment of female pattern hair loss. Conventional treatments for female pattern hair loss are fairly limited. One treatment that is offered to women with hair loss is the topical application of minoxidil. Minoxidil application topically can have some benefit in prolonging the hair growth cycle. However, the feedback I've received from the majority of my patients with female pattern hair loss is that they saw little benefit when using minoxidil. In addition, they felt that the liquid or foam application caused their hair to become matted down, making their hair loss look even worse. The drug spironolactone is a drug used to block testosterone on the assumption that the hormone testosterone is responsible for hair loss in women. In my experience, unless a woman has an unusually high level of testosterone, I've not seen a clear basis for using spironolactone in addition to TrichoStem Hair Regeneration. It's clear at this point that hair loss cannot be cured, but rather needs to be effectively managed. I made a paradigm shift since 2011 to approach hair loss treatment non-surgically rather than surgically as I had previously for much of my career. TrichoStem hair regeneration treatment has successfully helped over 99% of our male and female pattern hair loss patients. The results have exceeded the expected outcomes of more than one or even two hair transplant surgeries. Essentially, by thickening your thinning hair and reactivating the growth of your naturally existing dormant hairs, you can achieve significant scalp coverage without having to undergo surgery. Management for male pattern hair loss may include the use of finasteride to maximize the longevity of a hair follicle's lifespan. For women, hormonal therapy may be indicated for conditions such as polycystic ovarian syndrome or PCOS. Women over 50 whose hair loss is associated with low estrogen levels may consider supplementation with bioidentical hormones. A cure to completely stop hair loss or completely regain hair that is permanently gone is yet to be realized. Although your genetics cannot be undone, we can strategically manage your hair loss. We've established with TrichoStem Hair Regeneration that we can work within the constraints of your genetics and other variables to provide you with more hair for a longer duration than you otherwise would have had. I hope you found this information helpful. Thank you for your question.